And this is where I would need to know more from my colleagues, because although I do receive a little bit of that education in pharmacy school, I'm certainly not a specialist in the area of natural medicine. So the questions that I have with what she's using is how effective are they actually, what type of evidence-based medicine, and has there been any randomized controlled trials to test that? And so that's where I certainly know the treatments that I work with, and people are usually on it for maybe up to anywhere from 3 to 6 months. That, I guess there's one more slide, and I think I stayed within my time so far. So the important things whenever you're treating somebody for tobacco addiction is to really see their willingness to quit. When I first got into practice, it was me very much pushing people to want to do it. I would offer them discounted rates to help them quit. But really, if they weren't invested into it, they're not going to be successful. And I don't know if you've heard of stages of change, the stages of change model, and the perceptions that people have of their ability to be successful. But a lot of people are not ready. And so you have to really find out. Maybe it's just planting a seed and then having her come back and revisit it on her own time. Because you really don't want to, for lack of a better word, waste a lot of time on a situation where somebody's not even listening to you. So I'd really assess your willingness to quit. I also would look at how many prior quit attempts. It usually takes about 6 to 9 times for somebody to be successful with quitting. So that means it takes about several times to have failed and gone through that process before somebody has been successful. What methods have been previously used for quit attempts? Look at if she's used any other drugs and maybe consider different ones she didn't use before. Look at any barriers to cost, or maybe her insurance won't cover it. And try to enroll her into a tobacco cessation program if possible, because that is going to be, the drugs alone have a success, but they have a double the success rate when combined with intensive behavior modification. Usually the success rate is about 30 to 35% when the two are combined. And either one is used alone, it's about 10%. So it has a really powerful effect when you get behavior modification into it. And then always encourage the patient. Always say, if you're ready, just let me know and I can assist you in that area. And that is all I have to share. All right, thank you.
Hello. It's always good to check this before and turn it on. That's okay. My name is Joe Hardman. I'm from Oregon Health and Science University. It's really an honor to be here. I've been involved in these in the past, and I always feel like I learn so much more than I teach. So with that introduction, here we go. So I guess the first thing I want to ask as a busy clinician is it even worth my time to engage this patient in tobacco counseling? And obviously, we're all here, we're talking about this for an hour, and the unequivocal answer is yes, of course it's worth it. We all know that cigarette smoking is the leading preventable cause of death in this country, responsible for almost 500,000 deaths directly every year, not to mention all the indirect deaths or consequences. Surveys have shown that 70% of smokers at a given time are interested in quitting, 70%. And in fact, 40% of them have tried quitting in the past year. And by that I mean they've quit smoking for 1 day or longer. Unfortunately, unassisted quit attempts are really only successful about 3 to 7% of the time, meaning only 3 to 7% of the time that a smoker tries quitting on their own will they be abstinent at 1 year. So they need our assistance. We can really make a difference. There's a wonderful article published in 2008 through the Department of Health and Human Services that took a look at all the data from like 1975 to present regarding tobacco use and counseling and medications, and found that we are quite effective as providers in getting our patients to quit. And that time is a dose response. So you can see that if you spend 30 to 90 minutes cumulatively with your patient, this isn't consecutively, you can get a quit rate of close to 30%. Interestingly, if you go over 300 hours, which is a lot of time, you actually start getting a drop-off in abstinence rates. And I think that's because these are the patients that are very resistant to change. And so at a certain point, those patients are going to have lower rates anyway, no matter what we do. So in traditional Western medicine, we love mnemonics, first of all. That helps us pass the boards. So the thing that we teach our students and our residents is the 5 A's model. And I wanted to spend some time today talking about the 5 A's model for encouraging your patients to quit smoking. It's ask, advise, assess, assist, and arrange. And it's not really important that you remember these exact words, actually. It's sort of the general concept. And I'd say that underpinning all of this is this idea of motivational interviewing. And I'm hoping that you all know what this concept is, but very briefly, it's sort of, as providers, we have a wonderful opportunity to briefly counsel our patients. But rather than me saying, you need to quit, and this is how you're going to do it, it's much more effective and powerful if you can somehow get the patient to vocalize the need to change and how they're going to change. All right, so the change talk should come from the patient rather than the provider. If you look at interviews of providers that use a lot of motivational interviewing, the traditional ratio of the paternalistic physician talking to patient completely changes so that the majority of the visit is actually the patient talking rather than the clinician. I sort of liken this to sort of our secret Jedi mind trick, actually. These are not the droids you're looking for. And so it's a really nice opportunity to get what you want the patient to do, but have them make the case to do it rather than you. So let's go through a little bit of these 5 A's. So the first A is ask, and I put this beautiful picture here because asking is just understanding what the landscape is. This is going to set the stage for how you're going to approach the patient, where you're going to meet them, and how you're going to help them get to where you would like them to be. So I start off every visit with smokers as, is it okay if we talk about your tobacco use? I've never actually had any smokers say no, 0. And then I started getting into specifics. What brand do you smoke? Is it organic? Is it not? How many packs a day do you smoke? Did you grow up in a family that smoked? How much of a part of your routine is this? In order to understand your nicotine dependence, like Mark was saying, these 3 questions are really important. When did you start smoking? How much do you smoke on a typical day? And how many minutes after you wake up do you smoke your first cigarette? So if I'm seeing a patient who's been smoking 2 packs a day for 40 years and smokes their first cigarette 5 minutes after waking up, my approach to that patient is going to be very different than this 24-year-old who's already reduced some of her smoking. He's only been smoking for 7 years. The next A is advise. And although I did mention that what you want to do is you want to have the patient talk more and you don't want to be paternalistic, at a certain point in the visit, you as the provider need to say very clearly and in a strong manner and in a personalized way, I want you to quit. I think it's very, very important for patients to hear you say that. Whatever you say has huge weight to them. So something that I say, you don't have to use this as a script, but I say, as your doctor, I recommend that you quit smoking. In fact, I feel that quitting smoking is the most important thing you can do for your health. Dramatic pause there, intentionally. It sounds as if you've been thinking about quitting for some time. Let's talk about ways that and then you start delving into the Jedi mind trick stuff. But at first, you do need to say unequivocally, you need to quit. I really recommend you quit. And then assess. And so Mark brought up this Prochaska's theoretical stages of change model. And Prochaska and DiClemente in 1982 put forth this very elegant and nice, but slightly overly simplified, I'd say, way that patients seamlessly move from one stage of change to the next. For those of you who have practiced in a clinical setting, you know that it doesn't go in that nice format, and actually there are probably thousands of more arrows in there, but I do think it's a nice framework for approaching your patients. So your patients who are in pre-contemplation have no intention to change. They don't want to quit. So as Mark was saying, it's probably really not worth going into the specifics of a plan of how they're going to quit at that time. And in fact, more so than it not being helpful, it might actually be counterproductive. Studies have shown that in patients who are in pre-contemplation, when you start getting into specifics about how you want them to quit, and you should take this medication, and here, do nicotine replacement, patients dig their heels in the sand and actually resist change even more. So you have to be open to that, and it takes a lot of restraint sometimes, but I think it's still important to say, I'd really like you to quit, but it sounds like you're not quite ready yet, why don't we talk about this next time, and then you arrange close follow-up. Contemplation, those patients are thinking about it, they're contemplating it. They've identified, self-identified, some risks or some negative consequences of their smoking, but they aren't quite ready to quit. They're ambivalent at that point, and you have to work to try to resolve their ambivalence, and we'll talk about some strategies for that. Preparation, patients in preparation have identified the consequences, they're ready to quit, they just don't know exactly how yet, they're getting prepared to quit. So you, at that point, can step in and help them to move to action, which means quitting. They've quit for 6 months, they're, obviously they're ready to do it and they've quit. Maintenance is just working to try to avoid relapse. And I actually include this in my circle because 80% of patients do end up relapsing. So it's one of the natural stages of change. And I actually tell patients who have relapsed that. This is not unusual. Don't worry. We just need to get you back into the cycle and prepare to change again. So assist is the next A, and if your patient is in contemplation, that means they're ambivalent. They think that there might be something wrong with their smoking, but they're just ambivalent about making any change. And here's another mnemonic, the 5 R's. Again, you don't have to remember all the specifics here. This is really the thrust of motivational interviewing for smoking cessation, alcohol cessation, and substance abuse. Really what you're doing is you're trying to get the patient to voice the reason to change. You're trying to get the patient to voice why they should resolve their ambivalence and make a change. So these are some questions you can ask. Well, why do you want to quit? I ask this all the time, and patients are kind of surprised when they find themselves, well, I want to quit. They start telling me why they want to quit, and they had no idea in the first place that they wanted to. So again, you're trying to make the change talk come from them. How is smoking bad for you? How is smoking bad for your family? Patients surprise themselves by coming up with a whole list of reasons why they don't want to be smoking anymore. What are the benefits to quitting smoking? Save money, better health, I want to avoid heart attack, stroke, cancer, lung disease. My dad, he died at 55 because of lung cancer. Patients have these stories that are weighing on them. It's really helpful for them to hear themselves tell those stories. Less wrinkles. I've definitely used that a couple times. And not that all 24-year-old women are interested in wrinkles, but that might be your key with this particular patient. Roadblocks. What barriers do you have to quitting? What are your triggers? Does your spouse or your partner smoke? And how do you resolve that? Stress, weight gain, these sorts of things. You have to be very careful with roadblocks, though, because you don't want to focus so much on the negative aspects to quitting. Your reason for bringing it up with a patient is to have them bring it up and then quickly help them resolve it. Like, oh, well, maybe you can get your boyfriend to quit too. Or, the weight gain, we might attenuate that with starting you on the bupropion because that's usually associated with weight loss or whatever. So you're trying to quickly have the patient bring them up, but then address them right then and there so they don't seem so intimidating. And then repetition. So this motivational interview you're going to do every single visit and try to get the patient to hear themselves make the reason for change. If you have a patient in preparation, at that point I ask these 2 questions, and I find these are really, really helpful. On a scale from 1 to 10, with 1 being not motivated at all, to 10 being absolutely 100% motivated, how motivated are you to quit smoking? I've never actually had a patient say a 1 or a 2, interestingly. I have had a lot of patients say 3. And instead of being like, oh great, they're only a 3, I actually turn it around and say, great, you said 3, why didn't you say 1? And then they think, oh, why didn't I say 1? Maybe I'm more motivated than I thought I was. This is this sort of Jedi mind trick thing, that you're getting them to think, wow, maybe I am more motivated than I thought I am. Same with confidence. On a scale from 1 to 10, how confident are you that you can quit tomorrow? Ideally, you want them to be around a 7. The studies have shown in motivational interviewing that around 7 is the set point where they actually are more likely to be successful. If they're lower than that, I often ask, well, what would it take to move you from a 5 to a 7? And then again, it's starting this change talk all over again. So if you have a patient who's really motivated and really confident, that's the patient you want to develop a plan with. Okay, these are some strategies we've already talked a little bit about. In addition to all this counseling I've done, I will sometimes offer medications. most often nicotine replacement therapy. I refer them to 1-800-QUIT-NOW, which is a federally funded program. It's actually very well done. QuitNet is a really nice website. Lung USA is okay. It's very important that these patients set a quit date. So for this particular patient, I would commend her for cutting down her smoking in half. That's very impressive. How did you do that? You know, and get her to tell me why. What were some of the things she did to change her behavior? But really, the studies show in order to be effective, in order to be abstinent, you have to set a quit date. You have to go from being a smoker to a non-smoker. And I tell patients that. Throw away your ashtrays. Throw away your matches. Throw away that carton of cigarettes. You are a non-smoker starting on February 5th, or whatever they decide. Again, identifying triggers and cues to smoke, and then how to manage them. So you're gonna help them come up with ways that they're gonna manage these triggers. And then provide self-help materials. We have a lot of nice materials in our clinic, I'm sure you do here. And very importantly, involve family members in social support. So if she has a boyfriend who smokes, this would be a wonderful opportunity to get him involved in the plan too. This is a summary of some of the data around the nicotine replacement and the medications and their estimated abstinence rates. You might be surprised to see that nicotine replacement, when used in combination, has the highest abstinence rates, higher than the medications. So these are all over the counter. They don't require a prescription. Unfortunately, insurance doesn't cover them either. But I try to steer people toward that. The medications can be helpful. I certainly have patients who say, I want that medication, it worked for my friend. And if that's what they want, if that's what they need to change, I will do that. But I usually try to do nicotine replacement. The number one barrier for that is cost. I can't afford all that. My insurance won't cover it. At that point, I usually go through a little math. So in Oregon, a pack is $5.59. So if a patient is smoking a pack per day, it's about 39 bucks a week. If you go onto the internet, you can get nicotine patches. It's $24.98 for a 2-week box, right? 14 patches. So that's $12.49 per week. If you then combine that with gum, 100 pieces for 26 bucks, maybe they would use a box a week, although I've certainly had patients who use more than that. The total per week is $39.13. The total per week is $38.47. So I always tell them, give them this math. Like, it's actually not any more expensive. If you're not going to smoke anymore, it's actually the same, and eventually you get off of it, you get to save $40 a week. I'm not going to go into all the details about the medications, but they are effective. I've used them relatively frequently. They all have a ramp up in their dosing. It is recommended that you start them 1 to 2 weeks ahead of time. There are some contraindications, as Mark already mentioned. Very common side effect with bupropion is insomnia anxiety, so the second dose should be no later than 4 p.m., or else you're going to affect their sleep. I really would exercise caution in people with bipolar. Bupropion is not technically a stimulant, but it acts like a stimulant. And it's been studied in ADHD recently and found to be helpful, so just be aware of that. Although, because of that, it also causes weight loss the majority of the time, so that can help attenuate some of the weight gain that patients tend to get. Chantix is a nicotinic receptor agonist. It has another ramp up. You can order it as a starter pack, and again, you start 1 to 2 weeks before they quit. They have these warnings about neuropsychiatric side effects. And cardiovascular side effects is a more recent FDA warning in June of 2011. They actually found that there was no statistically significant increase in cardiovascular events, that is mortality, but also non-fatal MIs and strokes. But in every single randomized study, 15 randomized study, they always had an increased risk of those. It just didn't meet statistical significance. So the FDA thought there was enough there to put out this warning. And we're not, we just exercise caution in people who have cardiovascular disease. Nice study in GEM in 2000 looked at all the elements of smoking cessation and found that these 3 elements were most associated with successful smoking: social support, pharmacologic therapy, and this problem-solving technique, the motivational intervention that we spent some time talking about. You don't have to do all of them. Individually, these are helpful, but when you combine them, it's even better. The last A is arrange. Make sure you follow up with this patient. So anybody who I'm counseling on smoking cessation, I have them follow up in 1 week. And if it can't be with me, it will at least be with my nurse care manager. And then I have them come back in another month. It's very, very important to see them again and again. Review, congratulate in the absence. Wow, it looks like even though you didn't quit, you cut down by half of a pack a week. That's amazing. How did you do that? Again, building up their self-efficacy, their self-confidence. Think about slip versus a true relapse. If they just smoked a couple cigarettes in the last week, that's just a slip. That's okay. We can work around that. Maybe Maybe you should try the gum or a lozenge to help deal with those cravings. And then you can add a modified therapy and elicit new commitments to quit. That's all I have. Thank you.
Yeah. So these are actually the new, these were going to be the new warnings that were put on cigarette packages. They were approved. But then somebody filed a freedom of speech lawsuit against the company that was going to do this, and so now it's in litigation. So they're changing what they look like. But in Europe, they have pretty scary pictures on their packs. Anyway, so.
Hi, my name is Leslie Nicholas, and I'm a naturopathic physician, and I'm from the National College of Naturopathy. See, there I go, I'm doing the name again. The National College of Natural Medicine, but I still say naturopathic because that's what it was when I graduated. Anyway, I don't have slides, so we get to look at your lovely building, which I'm so happy to be in again, and I've had a huge tour, and it's really awesome in here. It's a really nice building. So, these gentlemen have kindly laid out all the baseline information that you all know and love. I'd like to comment further on those packages that there is in litigation right now. If any of you have been to Canada, they already have those lovely pictures on their packages of cigarettes, and furthermore, you don't get to see the cigarettes. They're behind black doors. So they're not even in the view for anybody to look at. So I was pretty amazed about that. And the reason I know that is that I'm married to a smoker. So I'm very familiar with all the ins and outs and whatnot, watching somebody who is a smoker who's also quit many times and is currently a smoker. I think one of the most interesting points that my partner made was, you know, we ask people to be quitters. She goes, I'm not a quitter. Don't ask me to be a quitter. And that's a very interesting linguistic point of view. It's like, well, I will stop this behavior and maybe adopt some new behaviors, but I'm not going to ever say I'm a quitter, because that just doesn't sound right. You know what? I really can't argue with that. So on that sort of positive note, as it were, I like to actually commend smokers for things that they're really good at. And smokers are professional at being break takers. They are. They're professional break takers. That's really awesome. The people who don't smoke never take breaks. They need to take a break. So I say to smokers, wow, that's really awesome that you have this, of course it's driven by nicotine addiction, but that you have this little driving thing that says, hey, I should go out and take a break. And not only are they great at taking breaks, but what are they doing at those breaks? They're breathing deeply. Yeah, they're smoking cigarettes, but they're breathing deeply. Again, more than their counterparts who are not taking breaks and likely are breathing very shallowly at the top of their lung fields, right? So I like to let smokers right away know that they're already good at doing something really good for themselves. And so I actually encourage them in many ways to go out and take those breaks anyway, but without their cigarettes, and just try it. Try it on for size, see how that feels. It's telling the body the same set of things. It's that deep breath in. We're gonna get some endorphin release. We're probably going to make a few receptors happy, some not so happy, but I like to start it at that juncture with a positiveness of what they're already really awesome at. So am I an expert at having smoking cessation happen with my patients? Not necessarily, but I do deal with a number of populations of people where that comes into big play. One of the community clinics that I work at is Outside In, whose mission is to serve youth under 30. And if you can imagine, we've got a lot of drug use going on and also a lot of cigarette smoking going on. And in younger people, it's really hard to have the motivational conversation, because sometimes there's nothing I can say that's going to make it cool to quit smoking at all. And another clinic that I work at is INACT, which is a Volunteers of America. There's a community clinic in there to help the clientele there, which It's a drug, mainly there's a number of different drug and alcohol programs, and also they also operate the Multnomah County diversion program, the STOP program, so that if you were arrested and had alcohol in your breath or drugs in your possession that didn't belong there, that you could actually choose to enter this program for a year and with lots of counseling and all that kind of good stuff, and then have that erased from your record. So again, in this particular situation, I'm dealing with people who are off of their drugs, and not only are they off their drugs, they're off of them immediately, so they're going through withdrawal from things like heroin and meth and et cetera, et cetera. But guess what drug they're not off of? They're not off of their cigarettes. That's always the last thing to go. We want to give somebody something to hang on to sometimes while they're quitting their more extensive drugs. But I like to maintain that tobacco is one of the most addictive drugs that there is out there. And you accommodate to it very, very quickly. In other words, if you've never been a smoker and you smoke a cigarette for the first time, you look pretty funny because you're like coughing and hacking and oh my gosh, this is horrible and I feel like I'm going to throw up and all that stuff. But it's amazing that the body within hours can accommodate to that, and within days you can, you know, be smoking right along, and those little nicotine receptors are starting to go, hey, let's make more of these receptors. And that's also the problem with nicotine addiction, is that the acetylcholine receptors start to increase and they want more and they want more and they want more, and so the body is seeking that, as it were, on a regular basis. So I like to let tobacco users know that I'm there to support them, because this is going to be, even if they were a heroin user before, that was nothing compared to trying to quit smoking cigarettes. So, and relapse is a part of it, as these gentlemen have alluded to. It's almost, well, I'm sure we can all tell stories about somebody who quit something and they never went back to it. It happens, definitely. But mostly relapse is actually a part of the recovery process of realizing that we are human beings, and it gives us a point of forgiveness within ourselves and to move forward into what the next step is. So what do naturopaths do around smoking cessation? I always turn it over to the acupuncturist, because I think they have all the best answers. No, quite honestly, I'm a huge proponent of Chinese medicine and acupuncture, and I think so many things can be addressed in such a lovely, calming atmosphere, and then you get to go into AccuLand, and that's even better than smoking cigarettes. So it just doesn't get any better than that. And that can include ear seeds, and I'm not going to go into all that because I'm sure that will be spoken or addressed. But those are the kinds of things that I like to recommend off the bat. I mean, the ear seeds, I think, are very awesome because people can be, you know, pressing them and helping themselves decrease their craving for cigarettes, or just calm their general shen down. Can I say that? Is that the proper use of the word shen? Okay. So all those sorts of good things. But as you know, there's a whole armamentarium of calming herbs, and that's lovely, and it's an individual thing. You know, some people love valerian, and other people are like, wow, that smells like dirty socks, I'm never going to take that again. And so you've got to work with the individual person and how they want to do it. So one of the things that I like to recommend is the herb lobelia. And lobelia contains lobolines, which nicely fit into nicotine receptors and kind of palliate that craving. The thing with lobelia is, if you're doing it in an oral tincture form, it's literally drop by drop. Because if you go too high, now you're going to create nauseousness and all the things you don't want to create. So that's one aspect of doing it. Sometimes lobelia is in a combination with other calming herbs. But again, if it was lobelia by itself, it's literally sometimes just 4 to 6 drops at a time. And sometimes that can be too much depending on the size of the person that you're dosing it with. I also love to use homeopathic tobacco. I'm kind of a rogue homeopathy person, and sometimes I use them lesionally as opposed to constitutionally, but there's always a constitutional homeopathic remedy which would address the whole person and probably maybe cut at some of the underlying behaviors that continue to support their nicotine habit. but I don't stand on that one very often. It seems like it takes more of a combination of things, behavioral-wise and whatnot, to get somebody to that quit point. The interesting thing I find about all the groups and doing it with lots of rah-rahing, and there are certainly people who need that, but I also believe strongly there's a portion of our population that don't want to have anything to do with group anything. And in fact, they're going to do it on their own. And I know personally, my mother quit smoking cigarettes without telling any of us. She didn't want anybody to know because she wanted to secretly and quietly do it all on her own, and poof, all of a sudden it's like, hey, you're not smoking. Yeah, I'm not. And this was after my father had a heart attack, who had quit smoking before her, and so she was now motivated to not smoke either. You can use that family history sometimes it flies in the face and they're like, yeah, screw you, that doesn't mean anything to me. I like to also remind people that it's not just about the lungs. I mean, we always associate the risks of smoking with lung cancer, but bladder cancer is right up there as a big one too. And, you know, we could go on and on about the related cancers to smoking. We could talk about how smoking really helps the human papillomavirus do its little job, and in relation to cervical cancer, then we're saying that that's exacerbating that possibility there as well. So sometimes I like to inform people in other ways that they're not familiar with about what smoking, because everybody knows that it causes lung cancer. They're like, whatever, I could have had a VA. You know, it's almost like it's old news, it's passé, you're not making a point with them, because everybody knows it's bad, right? So we've got to motivate on different places with that. So sometimes I do what's called harm reduction, meaning they're probably still going to be smoking cigarettes, but what can I do about that? Could I encourage them to smoke organic cigarettes? Most people who've tried the American Spirit brand, who smoke commercial cigarettes, are like, ah, those burn so slow and they taste different. And I'm like, yeah, they don't have all that cork in them, basically. I mean, yes, there's still tobacco there, there's still nicotine, and there's still the effects of that, but at least it's a little less crap. And the other issue is the cigarette does smoke a lot, or burn a lot slower, so they're going to smoke less. They're putting it out with a half a cigarette to go. And I'm like, that works for me. You're not smoking the whole cigarette. So, and also they alluded to eliminating places to smoke, and this is where I bring in, so not only are you a smoker, but if you're smoking in your car, you're a smoker and you're breathing your own secondhand smoke. Wow, double jeopardy. You know, I kind of get kind of jokey about it because sometimes that's the only way to get at people, and to kind of let them hear the information without feeling like I'm coming down on them about it. But that's the kind of thing I like to present to them. Same within the home. Are you transporting children in the car? Oh my goodness, you are not smoking in the car, are you? And you know, bringing up the idea of how can you be a model for your children, for your family, for other relatives or whatever, or people in the community who may look up to you. You could be that model of how you can quit and show how that can be done for other people. So I try in many ways to kind of bring them back to the information, as it were. And one of the other places where I practice is I do a lot of transgender medicine, and I bring that up only as what that means is that I'm putting people on hormones. And so the risk for being on a hormone is clot, right? So if you're a cigarette smoker on top of that, that's just kind of like tripling that risk. So I get very descriptive and I talk about, I try to get them to imagine a tube sitting here in front of them. This is your vascular system, this is your artery, and it's this big right now, and now we're going to put you on whatever hormone we're going to put you on, whether it's testosterone or estrogen. Let's talk about testosterone. I said, well, now that turns on the bone marrow and the red cell production, so now we've got more red blood cells in that same size tube. Ooh, getting crowded in there. Oh, it's also turning on cholesterol. Oh, wow, now we're really getting, we got more red blood cells, we got more cholesterol. And did you say you were a smoker? Do you know what that does? Takes it down to this little size right here. So I get very kind of graphic and pictorial and really like to present to them, because sometimes I don't have, in a way, time to encourage them to quit. It's like, I'm sorry, there is no time. You have to quit yesterday, because I'm helping you with something that you really want to have done for yourself, but you really need to plan this out for the entirety of your lifetime, because there is no way you can get away with being a smoker and being on hormones for the rest of your life safely. It's just not going to work, so think about it right now. I thought it was really cute when I had a patient come in who had only been smoking for 2 months. 2 months. I was like, ooh, brand new. And I brought up this whole conversation, and they assured me that it was going to be very difficult for them to quit their cigarette habit, which was all of like 2 or 3 cigarettes a day. And I just about leapt out of my chair, and I basically said, you know what? This is the time. It's not going to get any easier than right now in this moment. If you wait any longer, it is only going to get harder because you're so new into the situation. So anyway, there are other ways to help people with lavender oil. Some of you may have seen the recent evidence-based medicine that came out comparing it with lorazepam, and I've seen the efficacy of that. Essential oil of lavender works really well in reducing anxiety, and as we all know, that's a huge component for smokers, at least in their mind, why they're smoking cigarettes. And so, again, there are multiple ways to go about supporting somebody, and I just try to go at it by, number 1, referring them to acupuncture. Number 2, putting out a plethora of ways of behavioral changes and connecting up with those behavioral changes, and a whole bunch of nutritional support around that to assist them in being successful in quitting smoking. Thanks so much. I turned it off.
Oh, perfect. See if I can make this thing my friend. You just fold it up. Have it. Wow, look at that. Grand it is. That. Good. So, thank you. One, I want to apologize to Mark, Joseph, and Leslie and thank them for picking up my slack there. We were in a meeting upstairs, and at the start of the meeting they said, oh, you're on at 1, so you have to leave here early. And I was like, oh yeah, okay, that makes sense. Although somehow it didn't feel quite right, so we were just about 45 minutes behind on that, so I apologize. Yeah, smoking, so let's see. I have some, obviously this is the case that they're talking about is the case that I presented. It's a case that I have in my private practice, and I've treated smoking multiple times, different people. I chose this case for some specific reasons because of other things that the patient had going on besides just smoking. And just as some background, I actually was a smoker. I grew up in a family of smokers, and I rode around in the car like this as a child all the time with my mom yelling at me to get my head out of my shirt because I was stretching my shirt out, and I would be like, oh, but it's horrible to smoke. And she's like, I've got the window cracked, it's not that bad. And my only person that I wasn't able to get to stop smoking so far that I've worked with, there's been 2. One patient and my mom. She was like not going to stop smoking no matter what, and so I just loved her anyways, that's okay. But I was a smoker. I started at age 15, and I started smoking, stealing cigarettes from her, and eventually she would buy me cigarettes, oddly enough, before I was 17. And I smoked until I was 21, and one of the things that I wanted to do more than anything was quit because I felt horrible all the time, and it was very difficult to do, and the only way that I did it was I moved from where I lived in LA, where everyone that I knew was a smoker and everybody I hung out with smoked. I moved away to do something different, to live somewhere else, and on the drive there, I smoked my last cigarette, and when I threw it out of the car, I never smoked again. I just got to where I was, and I was tired and stressed out from driving all night, and I went to sleep, and I woke up the next day. I was like, I've got to try and quit, and I started meeting people, and eventually everyone that met me knew me as a non-smoker. And so it just seemed right to not continue smoking, and I felt better. And the longer that I stopped, the more that I felt better through that. And so it was I'm one of those cases where I was just able to quit and did, which I think is a rare thing to have happen, but I just stopped and never went back. And I did slip, as you saw from some of the presentations before, where I would try it again at other times, and every time I would do it, it would be the most horrible, obnoxious taste I could imagine, and I would be like, why was I ever doing this before? And it actually reinforced for me quitting. So I was lucky on that way. Most people do not fit into that category, as you've heard them talk about before. So smoking cessation in Chinese medicine, if we just look at it in some specific ways, we look at it as, obviously you have wind heat or wind heat toxins invading the body, and the person is actually doing that to themselves. So we see that as stuff coming into them and invading into them. Lung and liver are the two places that we're focused on initially with this. Lung, because obviously they're inhaling into their lung. Liver, because the liver is our primary detoxing method in the body, and we're coursing and draining and getting everything out. So we've got to help those two systems in anyone that's smoking. The second thing is the potential underlying conditions that the person has. What are their underlying things that they have that predispose them towards either smoking or the need to smoke? Stress, grief, sadness, all of these different kinds of things that can be there. And their own diet, lifestyle, etc., all of those things that are going into this. And then we look at other meridians that are going to be affected, lung and kidney. Anytime I see a patient with a lung problem and we go and treat that, for instance, like I see an asthmatic patient and I'm treating them for asthma and it's in their lung, and they get treated with antibiotics, steroids, and those kinds of things, now that person has a kidney problem from my perspective, from our Chinese medicine perspective. So the things that they do drag their problems into other places, from out here on the surface to deeper into the body. So we want to look and see where this stuff is going for them. Potential treatment methods, as she was mentioning, Leslie was mentioning, acupuncture is one of the main things that I do, obviously, so I obviously use that for this. The 5NP, which is the 5-nosate protocol in the ear, so 5 points that are in both ears that we use specifically for this. Now, this protocol has a lot of attention these days. It's being used, Acupuncture Without Borders, it's being used in trauma treatments everywhere. It was used in Hurricane Sandy cleanup, it's used in the Newtown shooting, it's used everywhere now because it just works. You put those 5 points in people's ears and it just helps them to deal with things and overcome things so much easier. The biggest progenitor of this treatment right here in the entire world at this current state, anyone know who it is? The United States military. The most use of this protocol right now, other than in individual acupuncture practices, is the United States military, using it for combat and PTSD and all of this kind of stuff. It works really well, and there's a lot of research about it right now. So it is in your interest to see that research because it really does work. So for us, we're using the acupuncture in the 5NP, and I usually do that daily. And I usually leave it for about 45 minutes. So then you go, well, how is the person going to do that daily in their busy life? So if they can't do it daily, then I use the ear press tacks or ear seeds, and I put those on in between the treatments. But I really do encourage the person to come in as often as possible to the office. Now, when they come in, I have my office set up where they come in and I just throw those needles in their ear and put a couple points in, and they just sit there and read a book or something. I don't charge them a full visit charge. It's not $1 million to come in. I just charge them here. It's a small fee. Just come. I'll throw these in. Just sit there and read for a while. It's a nice little break for you. Anywhere. Do it on your lunch break. Do it anytime you want. It's a very simple treatment. You can put it in about 30 seconds and be done with it, and the person can sit there for 30 to 45 minutes. They could eat their lunch while they were doing it if they needed to. So I just have them do it as often as possible. And in between that, I put in the ear seeds. And I leave those on the press tacks so that they're on their ear. All they have to do anytime they're feeling stressed out, they just reach up and squeeze on those points a little bit, and it helps to reinforce it. And it works really well. The other things here, herbal medicine, I have specific things we'll show you here in just a minute for that, and some other modalities, of course, meditation. And then the other thing that I always use is referral to all of the fine folks that you see here, because it's not something that anyone can do generally just on their own. One of the things that you want to do is you want to integrate and bring things together so that the person is getting reinforcement from multiple different levels, because everybody has a different perspective. And when someone is trying to quit, you want to look at them on their mental level, on their emotional level, on their physical level, on their spirit level. You want to have all of those things working together, and you want to work with as many modalities and ways that you can to reinforce that, because it's the reinforcement that's going to help them the most. The more that you reinforce that, the better off they'll be. The main things that I want to focus on, besides the treatment that everyone can use, is the lifestyle modification. What I always do with patients that are trying to quit smoking is that I try to get them to think differently. First thing, and it's like Leslie was saying, you don't want to teach them or try to help them to say, you're going to quit, you're going to be a quitter, because people in their minds attribute that to something negative, and you're trying to do something positive. So usually what I do is I change that dialogue to an overcome. You're going to overcome this. Because it's not you that wants to do this, there's something in your mind, a chemical reaction that keeps saying, do this, do this, do this, do this. That's not the same as quitting. That's overcoming something that's happening. And so the more that you help them to feel like that's what they're doing, the better off we'll be. So for instance, now we'll keep going here. Some special concerns, weight, age, other diseases. These are things that you can use to help them to decide you have a family history of heart disease, you have a family history of cancer, you have a family history of other problems. Smoking helps encourage those things. We can decrease those. How long have they been smoking, this kind of stuff. Someone who's smoking 1 cigarette or 2 cigarettes a day and has been doing it for a little bit of time versus someone who's been smoking 20 cigarettes a day for 20 years, those are going to be completely different things that you're going to be trying to treat. And in a lot of ways, it's still smoking, but the way that it's going to be affecting them is different. As soon as, from our perspective, and even from the Western perspective, from our perspective especially though, as soon as the person stops smoking, the body begins to try and heal. It tries to reestablish balance. It tries to put itself back together again. So no matter who you are or how long you've been smoking, as soon as you stop, your body is on your side trying to help you. Now, the other things, the smoking that you've been doing is trying to not get you to stop, because there's chemical messengers in your brain that are saying, no, don't listen to them. We want you to keep smoking. So it's just a matter of breaking that cycle after that. And then treatment, frequent as often as possible. The case here that we're talking about, 24-year-old female. She's been a chronic smoker for 9 years and smoking, and a heavy, that should be different, chronic smoker for 7 years and smoking for 9. She has chronic springtime allergies, so every spring she is burdened heavily by allergies. Both of her parents were smokers, and her father had heart disease. Her mom quit smoking when she was young. Her father smoked till his first heart attack. Frequent colds. She gets colds several times in every season. So in a year, she may get 8 to 10 colds. And that doesn't make her very happy, and so that's what's going on, or the allergies. So those are tools that you have with you. I don't want to feel this way. Well, smoking is directly linked to these things. We can help that. She has a very stressful life. She has a lot of pressure from friends. For instance, most of her friends are smokers, and she's tried to quit several times, and that impinges on her ability to quit. She also has endometriosis, or a history of that, and she has menstrual issues. So right there is another tool for you in your arsenal of how can I help with this, because smoking with this kind of problem, endometrial problems, is only going to lead to future problems. Remember, as any physician, but especially from Chinese medicine perspective, we are trying to prevent disease before it begins, because once it begins, it is much more difficult to treat it than before it begins. Waiting till the disease begins is like digging a well after you're already thirsty, right? Let's get some water, I'm thirsty. It's going to take us 6 weeks to dig the well. Well, that's not going to work. So you want a different kind of approach. want to try and prevent those things. So if you see someone that's smoking now and they have endometriosis or have had a history of menstrual issues, anything that is going on here, we're going to see a reflection from the smoking. And then the next thing here, currently where she's at smoking. So diagnostics, we make a lot of different diagnostics. We'll skip some of that stuff in this. So here's our treatment for this patient. So I used 5-NP, lung 7, and I usually use an extraordinary vessel treatment almost always with patients, for those of you that know acupuncture. So lung 7 would be paired with kidney 6 in this. Tianwei, which sometimes is translated as sweet breath, it's an anti-smoking point specifically. And then I used GB20 and 24 daily applied for this patient. Every time that she came, daily or 3 times a week, she was coming. She was very ready to do it, and I was charging her $10, just come and sit down for lunch, and that's what it is. So she was paying $30 for the week, and then she would come once a week to a regular visit, and I would do these points. So these ones for calming her mind down and helping to harmonize her mind. GB20 and 24, literally on MRIs, you put those in, you watch the person on MRI, you can see their brain waves just coalesce and harmonize and start functioning better. Their brain literally starts working better. So you help the person on every different level, not just on smoking in the lung. Then I used acupuncture case specific for her, some things to improve digestion and lung function, help the liver detox, and I did this kind of bi-weekly or as often as she could come in. Ear seeds on those same points, every day, all the time. One of the herbal treatments that I like to use is one called Smokeless. It's from Wise Woman Herbals, and Leslie was talking about the herb lobelia. Lobelia is in it. Lobelia actually has nicotinic binders that help bind to the same sites in your brain and your gut, actually, that you have the nicotine craving. So if you keep craving nicotine and you give it something that goes and fills that space, it helps the craving to be less. And it's not the same thing, so it starts slightly changing the biochemistry and the way that the body is perceiving the receptive of this material. It also has a number of herbs in it to help improve lung function and to help get rid of what we would call heat, toxin, and phlegm from the Chinese perspective. And so you're working on multiple